And welcome back once again. Dr. Stania De Jesus at the Family Health Center of Charleston wants to make health care affordable and accessible for everyone. She's joining us now with more affordable monthly membership health care plans. From New York, studied in New York, been in Charleston for a few years. You were at a medical complex, so to speak, for a number of years, and you were seeing a lot of patients in a very short period of time, and you felt that there was better care that can be given to the patients by opening your own practice, and that's what you did.
Yes, that's exactly right. I was at a traditional family practice and being forced to see maybe 25 to 30 patients in a day period.
Felt more like a conveyor belt, didn't it? Yeah.
It did, it did. It felt like we were just getting the patients in and out and not really able to provide quality care for them. So I did that for about 3 years and learned about the direct pay model and decided to leave that practice and start my own.
Tell us about your practice. It's very unique. There are slowly but for surely a number of doctors that are going in that direction because they prefer the more direct personal care at their pace.
Right.
Instead of spending, okay, I can only spend 15 minutes. My corporate says I can only spend 15 minutes.
Right.
You're saying if I want to spend a half hour with my patient, that's what I'll do.
That's exactly right. And I see my standard appointments are 30 minutes, and I have spent up to an hour with people, need be or more if it's necessary. And that's because I'm not working with the insurance company, and the patients are paying me directly. And so that's exactly what direct pay healthcare is. The patient contracts with me directly for their health care. And so patients can contact me via email, text messaging. We could even do virtual consults similar to Skype, and then those longer office visits.
Your office is located on University Boulevard.
It is. We are a block up from Trident Hospital in the Trident Executive Village, and it's just myself, and I have an assistant. She's a nurse, and we run the show there. So when patients come to the office, I'm actually sitting up front. I return patient phone calls, which is, most people don't believe that.
Who would have thought of something so original?
Exactly. I actually answer the phone sometimes. So,
well, very good.
Yeah.
You know, a lot of people, they will have a deductible in their insurance. And there was a great article in the Post and Courier about you and your practice. And one particular lady, she had a deductible on her insurance that was $2,700 a year.
Right.
So she would have to spend that $2,700 before the insurance started to kick in. You have insurance plans, individual insurance plans from, I believe it's $35 to $59 an individual per month.
Right, that's exactly right. Adults over the age of 21, it's $59 per month, and under the age of 21, it's $39. But I caution just not to call it insurance because it's not insurance plans. That's the payment for my health care to them. But if you have that deductible, you don't have to worry about that. Just that monthly fee cares for your primary care services. And so there's no additional bills from the insurance company. There's no copay from the insurance company.
Oh, wow, that's fantastic. Most of the people that come in and see you, let's just say the overall average individual coming in, what are they coming in to see you about?
Oh, I mean, I'm a family practice doctor, so I take care of chronic medical conditions, diabetes, high blood pressure, high cholesterol, weight management.
And whenever somebody, let's say if I wanted to get that plan, that's what, $59 a month, what would that cover for me? How many times could I come and see you per year, and what would that give me?
Yeah, so that actually allows you to come into the office 6 times per month, and there's no additional charges for that.
Did you say 6 times per month?
I did, 6 times per month, and there would be no additional charges for that. Anything that I can do in the office, say if you had if you were sick and we needed to test for flu, or strep test, or an EKG, anything that we can do in the office, any procedures that I can do, there's no additional cost for those either.
So the lady that was being talked about in the article, she was spending $2,700 a year before any of her insurance kicked in.
Right.
And with your plan, if she's an adult, it's about $720 a year.
Exactly.
That's a no-go figure right there.
Yeah, it's a large cost savings for people. It definitely is. And I see a lot of people who have those high cost deductibles and they're unable to go to the doctor because even though they have insurance, they're not able to meet that deductible. And so they're unable to get the care that they really need. So a lot of the people that I'm seeing now have uncontrolled medical conditions because they weren't able to access a doctor. And this allows you to see a board-certified family physician
Absolutely.
for $700 or so a year.
That is fantastic. Children are a little bit less?
Children are $39.
Okay,
Yes.
that sounds like a bargain right there.
They're $39 a month, yes,
That
sir.
is fantastic. I can see your business expanding greatly in a very short period of time. I mean, you've got the Trident Regional Hospital there,
Yep.
which you can make referrals to if somebody needs it. That's not included in the cost that comes to you each month.
Correct. That's not included. That cost is solely for my services. That's all. So if something needs to go outside of my office, then there are costs associated with that. But for example, we're able to do lab testing for a significant cost savings. I'm able to order blood draws, like to test your thyroid or blood count or liver kidney function for less than $5 a test.
How about prescriptions?
Prescription medicines, I do have some prescriptions that I'm able to dispense in-house, and those are easily 85 to 90% discounted from the retail cost.
Wow. Yeah. That's pretty good. How can people get a hold of you, and what's your exact location of your office there?
Our exact location is at 9217 University Boulevard. We are in the Trident Executive Village, right up from Trident Hospital. And you can visit our website at healthcharleston.com, and we actually are able, you can sign up for a membership or contact us on our website or give us a call.
Wonderful.
Or we're on Facebook as well.
Dr. DeJesus, pleasure to have you with us
thank
here
you very
today.
much.
Make sure you go up there and see Dr. DeJesus. A very nice way, unique plan with serving the community with health care, that's for sure.
Yes, sir. Thank you.
Yes, ma'am. We've got more coming up in just a moment. Visited 843 Korean Barbecue and Sushi. Stick with us.